Today's topic of discussion is how to approach presenting complaint of fever. So in this, as fever can be a component of any disease along with cough, shortness of breath, any diarrhea, any joint issues, any cardiac issues. So we will just discuss the history of presenting illness, in which what differential diagnosis we should cover if a patient comes with a presenting complaint of fever. So first of all, in history of presenting illness, the first paragraph as usual is ODIPARA and the T, that is the timings, in which onset, duration, intensity, progression, associated symptom, relieving and aggravating, and the timings. Along with progression, you have to tell the pattern of the fever also. So for example, I would like that my patient, not diabetic, not hypertensive, non-smoker, presented with a complaint of fever for last 2 months, which was gradual in onset, 1 or 2 degrees Fahrenheit, progressively increasing, continuous, and the patient experiences daily and persists throughout the day and night. This fever is aggravated with activity and relieved with Panadol, but does not touch the baseline. And it is associated with fatigability, which he describes as lack of energy leading to decreased activity of the patient. It is also associated with any weight loss, any decreased appetite, early satiety, or whatsoever the association you are going to make along with fever. Then in the next paragraph, you have to discuss all the differentials. You will be keeping the first differential, what you are going to make the differential diagnosis. The first will be that one, and the other you will be starting from head to toe, that is from central nervous system. There is no history of any altered state of consciousness, any fits, any headache, weakness of any part of the body. Then coming down, there is no history of any discharge from eyes, ears, nose, or any pain in the eyes or ear. Then no history of any chest pain, shortness of breath on lying flat, or shortness of breath causing awakening at night, and or any previous valvular heart disease, or any use of intramuscular monthly injections. Then any previous history of shortness of breath, any past history of contact of tuberculosis or previous history of self-tuberculosis, any cough, any use of inhalers, any exposure to farms, pet, birds, or any whistling sounds in the chest, any abdominal pain, abdominal distension, altered bowel habits, any heaviness in the right and left side of the abdomen, or yellowish discoloration of sclera, any paleness of complexion or bleeding from gums, decreased weight and decreased appetite, lumps and bumps in the body, and drenching night sweats. This is for lymphoma. Then for kidneys, you can go for, there is no history of decreased urine output, any blood in urine, frothy urine, any urgency or frequency, genital ulcers or rash, or any itching over the genitals. No history of any joint pains, joint swelling, oral ulcers, facial rash, any joint deformity. Then for the infections, starting from HIV, there is no history of any high-risk sexual behavior, IV drug abuse, any use of steroids and immunosuppressants. Then no exposure to mosquitoes, no exposure to farm animals or use of any raw milk, and any history of traveling. And for lepto, you have already asked for this, any heaviness in the right and left hypochondrium, yellowish discoloration, and any exposure to poor hygiene environment and poor hygienic food. So this is all for the differential diagnosis of fever. Whatsoever you are going to make the differential along with fever, that you are going to discuss along with ODIPARA, and in the next paragraph you have to cover all the differential. And then in the third, as usual, we are going to cover the care of that disease, and then the investigation and treatment what we have been completed up till now. And then so on, after the HOPI, the past history, the medical, the surgical, the occupational, the functional, the vaccination, the allergic history, along with the socioeconomic history. So it was a short lecture. Thank you.